Are you considering knee replacement but think it means cutting off your entire knee?
Many patients think that getting a knee replaced is literally cutting off the whole knee and putting a new one. That's not the case.
Discover what a primary knee replacement really is and how it can give you back mobility without pain with Dr. Gerardo Mangino, so you can get back to the life you love.
What is really a knee replacement? What's going to happen? Like in what cases is knee replacement surgery suggested to a patient?
Okay, well, one of the top procedures is primary knee replacement. Primary means that it's the first time that you're gonna get your knee replaced. And we're not redoing anything, we're doing it for the first time. Many patients think that getting a knee replaced is literally cutting off the whole knee and putting a new one. That's not the case. What we do is we, of course, access the joint through an approach through the front of the knee. And what we do is basically resurface the knee. We remove the worn out parts of a knee because usually a knee replacement is done because of wear and tear. Imagine the tires of a car. When the tires of a car, they wear out with time, there's no way that the plastic on the tires will regrow in any way. Well, the cartilage in the knee and in any other part of the body is the exact same. Once the cartilage wears out, there's no way that this can regrow. There's new techniques and new treatments such as stem cells injections. They might work on some patients for some cases, but they won't make your cartilage regrow. And especially if you have any kind of deformity, that won't straighten out your knee for sure. So that's when we need a knee replacement. And it's basically, like I said, resurfacing the worn out surfaces and replacing them with artificial parts, which are basically made out of metal and plastic. And that gives you back mobility without pain.
Now, next would be the types of knee replacement. I believe there's total knee, there's partial knee. What's the difference between the two?
I have actually, so for example, this is a total knee replacement. A total knee replacement means that we have a component for the femur, which we substitute all the surfaces on the femur. As you can see, it has a certain shape, so we shape the bone into that. And then the tibia has this tray that we put into the bone, and this plastic or specific kind of plastic liner this is a total knee. Now, a partial knee is only replacing either the inside or the outside of the knee, or it could also be the front of the knee. So that's a smaller operation. It's probably easier to recover from, but not every patient is a candidate for a partial knee replacement because sometimes patients ask for specifically a partial knee replacement, and we notice that the knee is too damaged to replace only one part, and it's not recommended because there might be back sooner than later to replace the whole thing. So those are the kind of knee replacements that are. There's total and there's partial. And within the total, there's different grades of constriction of the knee. That means how stiff it's gonna be. And that depends a lot in the anatomy of the patient and the preferences of the doctor. Those are just technicalities that we take into consideration.
What does the procedure look like? How long would the surgery take?
Well, the surgery is a simple and straightforward procedure. Normally, what we do is before the surgery, we see the patient, the anesthesiologist sees the patient, take them back to the operating room. We start normally, and we always work with regional anesthesia. That means the patient is going to be numb from the waist down and with sedation, so they're comfortable during surgery. The operation takes around between 1 and 2 hours, depending on the case. Normally, it's around 1.5 hours or a little bit less than that. Then the patient goes back to recovery room. They're walking the same day or the day after, depending on the time of the surgery during the day. And the recovery, usually the first few days, are normally the toughest. But that's also why we've modified our anesthesia technique and our pain control manager so the patient can be comfortable in the first and the toughest few days, which are the day 1 to day 3 or 4 usually. And we now do a combination of medications, injections, or sometimes newer medications that we put around the joint or the knee after we finish the surgery. And that gives the patients very comfortable few days after the operation. Of course, Replacing a knee is a big surgery. It's a surgery that requires some time of recovery and might be a little bit painful. Our techniques to complete and to control pain are improving and improving within the past few years with nerve blocks, injections around the knee, with many new medications that we use that can handle or control pain for many hours after the surgery so the patient can be comfortably recovering the first few days.
Let's talk about the eligibility criteria. You mentioned earlier about looking at medical history, just making sure that they're healthy. Who is not now like a good candidate for a knee replacement?
Well, some patients might not be good candidates depending on their medical history, depending on, the medications they take, the illnesses they might have. So what we normally do in every case is once the patient gets here, and it's actually included in the package, we always do a pre-op evaluation, of course by me, the orthopedic surgeon, but with also the internal medicine specialist. So we do a series of blood tests, such as X-ray and EKG, some other studies, and the internal medicine specialist is going to take a good look at the patient and is going to give us all the recommendations and guidelines to follow during surgery. Now, some patients, even before getting here, we know because of their medical history that might not be a good candidate. For example, patients who are morbidly obese or are very bad smokers, patients who have had some sort of neurological disease or some other issues that might affect the recovery of the surgery, we know ahead of time that they might not be good candidates. We don't have what many doctors call hard cutoffs, that we definitely know that we are not going to do any patient, but we do have to evaluate at least the patient with some information ahead of time to know if the patient is a good candidate, because even if patients have some issues, some health issues, or we can always set the patient into the best, let's say, state before surgery, before to go ahead and do it. Sometimes we do it while the patient is here, and sometimes we start even before they travel, so we know once they get here, they're gonna be in good condition.
Excellent. Yeah, I recall actually having a patient, you mentioned, doc, like being too obese. Like they set up like a recommended weight. Once he hits that recommended weight, then he can do the surgery. So I kind of like understand now what you're explaining. Now this is the perfect time also for you to mention the implant brands that you use mostly.
Normally, the implant brands that I use the most are either Zimmer Biomet, which is one of the main companies worldwide. We've been using for a few years also a South Korean company called Corentech, which has also very good high quality implants. And there's other few brands that upon request for patients, we can use them, such as Stryker, the Pew. Those are usually the main brands that we use. We normally, as any other surgeon, stick to the ones that we know the best and that we've used the most. But either one of those companies manufacture excellent implants, and all of them, they have good, long-lasting records.
Now, quick information about the timeline for international patient, like either if it's for total or partial, like how many days should they stay?
Normally, for any kind of joint replacement, either hip or knee replacement, the length of stay here in Cabo is around 10 days. So normally a patient, we ask them to arrive 1 or 2 days before the surgery, so we can do any kind of tests or pre-op evaluation before the surgery, and then stay a week after the surgery, so we can give them a few, days of follow-up and see how they're doing. Usually we're very close nearby, either they're here at the hotel or they're close nearby, and we see how they're doing. So before they travel back home, we normally do a follow-up consultation here at the office so we can see how they're doing. They have a good blood thinner action. Every patient uses blood thinners for a few days after the surgery, especially because they're going to be traveling back on plane back home. So that's usually around the time to stay here in Cabo for around 10 days. It may vary depending if the patient comes from a longer flight, let's say, or from another part of the world. They might be recommended to stay a few more days, usually 2 weeks at the most.
Also, of course, the recovery. I know, again, it's different for everybody, but how long does the recovery take for knee replacement surgery?
For a knee replacement surgery, the recovery, the full recovery, I always tell patients it might go from 1 to 3 months, either 4 to 12 weeks. Some patients at 4 weeks, they're doing excellent. They're walking pretty much normal as they used to. Of course, a little bit of pain here and there. That within the next few days is going to go away. Some patients take a little bit longer because every patient is different. But normally a full recovery can go around to 12 weeks. Some patients even might take a little bit longer than that. And it also depends on the expectation of the patient. Some patients think that they're going to be back to completely fully normal in 2 weeks, depending on what they have researched, they have read, they have seen. But normally it goes from 4 to 12 weeks.
Lastly, for knee replacement, what are the common complications and how do you deal with them?
Well, the first complication that we want to avoid, although it's not common, thank God, it's infection. So that's what we want to avoid. Infection, either deep infection or it could also be a little bit of superficial infection on the wound sites. So that's very low percentage of complications, as well as blood clots on the leg or on the lungs. That's also extremely low numbers of complications, either from infections or blood clots. So the way to handle them, of course, would be depending on the time that we locate or we know that the patient has had or developed this complication. There's different ways to treat them. That's why we want to avoid infections at all costs. We use, of course, sterile techniques, of course, all the protocols that we use to avoid infections, including antibiotics, and all the do's and don'ts inside the hospital and in our practice. Now, replacing a knee, is important to know that it's not giving you a knee that you had when you were 20 years old. We are going to give you an artificial knee that is going to make your quality of life improve, and it's going to make you feel better and better. It's not going to get you back 25-year-old knee that some patients expect, but it's going to give you a great improvement in your quality of life, and it's going to make you go back to do all the things that you have not been able to do because of pain, because of stiffness, because of deformity and many other symptoms that arthritis can cause.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.